Hello, friends. My name is Juanita Smith, and I am the co-chair of Health and Human Services facet of the Central Illinois chapter, The Links. I am here with Gail Young. She is the executive director of the Susan G. Komen Memorial Affiliate. And Gail and I have something in common. Other than being good friends, we were both around 13 years ago when the Links launched the Taking Steps program with a grant funded by Komen. Yes, Taking Steps is 13 years old, and we are both extremely proud of what Taking Steps stands for and the number of women our program has helped. We have been partners for 13 years, and we hope this partnership continues throughout. Now, Gail, if you would like to say something about the partnership that we have.
Sure, I would love to. Juanita, first of all, thank you. And thank you to all of the members of the Central Illinois Links group. It has been a wonderful partnership, and it truly has impacted women in Central Illinois. You know, when Links and Susan G. Komen came together, even before Taking Steps, they worked on a program called Circle of Promise. And that program was about making sure that information about breast health got where it needed to be in the community, especially in the African American community. We had data at that time that talked about the fact that African American women were dying almost twice as often from breast cancer as white women. And it had to do with access, it had to do with education, it had to do with myths about cancer. And so Links, together with Susan G. Komen, decided they were going to address that. Circle of Promise started, and then the Taking Steps program came right here to Central Illinois. About the same time, we had our first Circle of Promise group in Central Illinois.
Okay, but I want everybody to remember what Taking Steps stands for. Now, the STEPS stands for screening, treatment, education, and programs. Taking Steps together saves lives. All of the information that our attendees receive at our programs help them to live their very best lives, and hopefully we can prevent many illnesses and have them learn about breast health, and so they can prevent and keep up with all the information that needs to be to have good breast health. So, Gail, I would like to ask you just a couple of questions. I heard you say that African American women are, once they get a diagnosis of breast cancer, they're more than, I don't know what the percentage is, but maybe you can tell us how often or how more likely are they to die because of this?
Well, actually the statistic is that they're about 40% higher chance of dying from breast cancer. And that's because African American women tend to have a much later diagnosis. In terms of the staging, they tend to have a much later stage breast cancer at diagnosis. And, you know, we've said for years and years that early detection saves lives. And that is so very true, especially in this case. The other thing is that African American women tend to have a higher percentage of what is called triple negative breast cancer. And triple negative just really means that the 3 cancer markers that doctors use to figure out how to treat breast cancers, what's the best treatment options, those markers aren't there with this kind of breast cancer. And so it is more difficult to treat. So between the late stage and the triple negative breast cancer, African American women die almost twice as often with the late stage diagnosis of breast cancer.
Okay. Now, just curious, I know over the past 2 years, we've done our Taking Steps program virtually. Now, over these past 2 years, have there been any recommendation changes that, like should they do, how often should they do breast self-exams or mammograms or anything? Has any of that changed?
It hasn't really changed, except over the last few years, we've kind of talked more about one of the issues with, we talked a long time about breast self-exam.
Mhm.
One of the things that did was that it made us think that breast cancer only presents itself as a bump or a lump. Don't have a bump or a lump, I'm in good shape. Well, one of the things where we've decided that people need to do is, you know what, it's important that you know your own body, that you know what's normal for your body. And that is by being familiar with your body. But there are also other signs of breast cancer there that would not present as a bump or a lump. A reddening or a rash on the breast, nipple discharge, an inverted nipple, a dimple somewhere in the breast. All of those can be signs that there is a breast health issue that you need to have your doctor look at. So we've kind of gone away from only talking about breast self-exam
Okay.
to knowing what's normal for you and being familiar with all the things that can be symptomatic of early breast cancer.
So it's very important that women take a look at their bodies and
Right.
know their bodies. Okay.
Absolutely. And we always said it's on a certain day in the month to do that. Well, we want you to be doing that all, every time you get in the shower,
Sure.
be looking and knowing what is normal for your body. And if something isn't, don't wait. Contact your physician and go in and have them looked at. All they can say is, nope, nothing to worry about. There's never any harm in getting in and getting something checked out that you have a concern about.
Okay. And are we still saying mammograms every year or?
Well, of course, over the last few years, that's become, there's a lot of conflicting information. And Juanita, I would say, that's been a really difficult thing because it's something that you really need to have a discussion with your physician. For many, many years, we said you need to start getting a mammogram at 40. And over the last few years, we've kind of gone away a little bit from saying it's absolute necessity at 40, because, for some women, they need to start earlier than that.
Mhm.
No, there's a family history. They have a direct familial relative that had a diagnosis at 40. Well, technically, one of the schools of thought on that is that you should start screening 10 years younger than that person who was diagnosed. So, if your mother had breast cancer at 40, at 30, you need to start having that discussion with your physician. If you are at average risk, Komen is still saying, start talking to your doctor at 40, and between the two of you, you decide when you need to start that first mammogram. There are other groups that have different recommendations. The American USPSTF, the American, we won't remember all of that. But anyway,
okay.
It is an organization that talks about screening, all kinds of health screenings. And their recommendation was starting at 50. 50, especially in the African-American community, we see African-American women being diagnosed younger. And so to say somebody don't start worrying about something till you're 50 would really, we would be taking risk with that. And so, you need to know your family history, know if there is that direct family relative that's been diagnosed, what age were they, go down 10 years from that and start that discussion with your physician about when to get that first mammogram.
And don't be afraid to talk to your physician about it.
Absolutely. You know what? You need to be your own best health advocate.
Absolutely.
You have to, you need to get in and you need to have that discussion, and don't let them, say, somebody tell you, oh, you know what, don't worry about it. You're fine. You're healthy. You're what. The other thing I would say about that is 80% of all women diagnosed did not have any direct family relative.
80%.
They did not, they were not looking at, oh gosh, this is something that is common in my family. So you cannot use that as, kind of as a reason to not start making those contacts and having that discussion with your physician, just because you don't have a known family history.
Well, very good. Okay, those are good. That's good information to know.
Absolutely.
Now, we know that this month, October, is Breast Health Month, Breast Cancer Awareness Month.
Right.
Anything that you want to leave with us?
Absolutely. One thing I would say is we love it that everybody wants to bring focus to Breast Cancer Awareness Month. Absolutely, absolutely important. But the other thing about that is that A for awareness also needs to stand for action. You know, awareness is fine, but if we don't take action, it doesn't really do us any good. So, you know, promise yourself, I'm going to get the information this month, and then I am going to do what I need to do. Do I need to make an appointment with my physician to talk about when I get my first mammogram? Do I need to schedule my mammogram? I've already had one. You know, one of the issues that we're seeing right now is that women have been told during COVID, hey, hold off, don't get your screening. Well, it is time now to get back and get those screenings. Yes, right at the heart of COVID, when it first started and we weren't sure about what COVID was really going to look like, what it was going to mean, we needed to you know, tell everybody, don't go to a healthcare facility unless you absolutely have to. But you know what, we're past that. We know now what we need to do to keep people safe. The facilities have all gone and taken extra measures to make sure that you're safe when you come in to get your mammogram or your screening. And so it is important that we get back and get screened. You know, COVID started in March of 2020. You know, we are over 18 months into all of this. Well, and some people think it probably started before that, before we even really knew what was happening. But we are more than 18 months into this. And so if you know, say you were due for your mammogram in March or February, you know, we don't always all go to the exact month. You were due early, right after the first of the year in 2020. You're going on almost 2 years overdue with your mammogram. And those things, you know, again, early detection is so important. That the earlier a cancer or a breast health issue is detected, the better the outcome. So we need to encourage people to have Breast Cancer Awareness Month, also be Breast Cancer Action Month. Gather information, make the phone calls you need to, whether it's to begin the process of talking about getting a screening or getting an appointment for your screening. We would really encourage people to do that.
So we want to leave everybody with the thought of being an advocate for your own body. You have and get an appointment, see your physician, get your mammograms, get your screening. And we want you to know that during this month, even though we're virtual, we still have on our website our Taking Steps program. It's an informational, educational program that helps our attendees be informed about their bodies and their lives. The breast health information provided, as well as other health information, focuses on healthy diets, healthy lifestyles, including nutrition, exercise, financial literacy, controlling your blood pressure, stress, weight management, diabetes. And this year we are also focusing on chronic kidney disease. This is a very important issue for African Americans also. So we are hitting on all of these subjects. Even though we're online, we are still putting out really, really important information. So we want every one of you to go on to our website, www.centralillinoislinksinc.org, and watch our Taking Steps, all the video. Just click on the video that you would like to find interesting, and I think you'll find the whole thing interesting. So please stop in and see us on the website, okay? Gail, we really appreciate you, and we could not do our Taking Steps program without Komen and you. So appreciate everything that you do.
Thanks for having me, Juanita, and you do a wonderful job. And I know that there will be women out there that'll get on that site and they will get life-saving information. So thank you for all you continue to do.
Thank you so much. We really appreciate you.
Absolutely.
Okay. Thank you. Bye-bye.
Bye.